Welcome back everyone to another episode of Fertile Ground with Dr. Jodica Ruba. When approaching your first IVF cycle, it can be hard to get a sense of what this time in your life is going to look like. So we thought we'd dedicate this episode to a quick run through of the timing of a cycle, the medications and appointments involved, from day one to the pregnancy test. Hi Dr. Jody, welcome back.
Thank you.
So today's episode I really wanted to talk about the typical cycle. So once you've gone through a bunch of testing, because we've got some episodes on that if people want to learn about testing.
Absolutely.
Once you've gone through your testing and you've decided you're definitely going to do an IVF or ICSI cycle, what does it look like? So first appointment through to testing to see if you're pregnant.
So an IVF cycle is actually a lot shorter than a lot of people think it is. And it usually, but doesn't always, have to start with a woman's period. So some ladies will start their IVF cycle and give us a call when they get the first day of their period. And then we start the medication to stimulate the ovaries. And that's always in an injectable form. So there are many different types of stimulating hormones, but we call them follicle stimulating hormones. And there are many different brands of those hormones, but you can discuss that with your fertility specialist. And that usually starts on day 2 of the cycle. There are some blood tests and ultrasounds that will be done through the cycle, usually no more than 2 or 3. But it really does depend on your fertility specialist and on the individual patient themselves, because what we're trying to do is stimulate enough eggs to give you a good chance of having a successful live birth and perhaps freezing some embryos as well. But we don't want to overstimulate the ovaries and cause a terrible condition called hyperstimulation syndrome. Ovarian hyperstimulation syndrome occurs much less commonly these days, but it can cause severe illness in the woman. It can cause us to cancel your cycle completely. It can cause you to become so unwell that you need hospitalisation. And it's due to very high hormone levels that can cause fluid shifts in the body. So we take that condition very seriously, obviously, and it can be worsened if you get pregnant during the cycle. So all of those things are important to keep an eye on through the cycle itself, and we monitor that through hormone levels, particularly estrogen levels during the cycle.
So this first portion of a cycle we're talking about is stimulating hormones to get as many eggs in the ovaries as possible.
Yes.
How long is that?
So that process is usually around 10 to 12 days of injections. We also give another injection usually, but not always, that started on day 6, a different hormone that helps to stop premature ovulation. So we don't want to lose any of those precious eggs that we're stimulating during that cycle. And the way we hopefully can predict the number of eggs that are going to be produced at the time we do the egg pickup will be through ultrasound surveillance. So a sonographer usually, or your own fertility specialist, can check with ultrasound and actually watch these follicles grow in the ovaries. And once they get to a certain size, we then are able to give a trigger injection, which helps to mature the eggs so that they're able to be successfully fertilised by the sperm. And that usually occurs roughly 36 hours before the scheduled egg pickup. And
so can I just ask about that scheduled egg pickup?
Yes.
If we go back to just talking about your stimulation period, is that pickup booked in already, so you know when that's going to happen when you start?
It usually, you can expect it to be around day 12. However, for some people, the egg pickup may not occur, and I always warn my patients that their cycle may be cancelled, perhaps due to poor response. Because we don't want to overstimulate the ovaries, we often start with a smaller dose of the follicle stimulating hormone. Everyone responds differently to different doses of follicle stimulating hormone. We try and predict the amount of follicle stimulating hormone we can give from a blood test called an AMH level. And this anti-Müllerian hormone helps us to predict how you may respond and what dose to use during an IVF cycle. So it's important that that is almost certainly going to be one of the tests you have before we start an IVF cycle.
Yeah, so we're going through this process and we're monitoring and we're surveilling as well.
Exactly.
Then it gets to egg pickup day.
Yes.
What does that day look like generally?
Usually that means coming in the morning and fasting, usually not having anything to eat or drink for about 6 hours, and the nurses usually will check you in and double check that the time of your trigger, because the importance of the egg pickup is to pick the eggs up at the correct time where we know they're going to more likely be mature. And during the egg pickup process, most ladies will have what we call sedation. So sedation is a type of anaesthetic where women are not aware of what's going on. So it's usually intravenous sedation, so a little drip is put into the back of a woman's hand and an anaesthetist will look after the woman, so someone qualified to keep you safe during your egg pickup process. And the anaesthetic itself lasts maybe 10, 15, 20 minutes at the most, and then a transvaginal probe with a needle attached is popped into the vagina, and we're able to visualise the ovaries that lie on the other side of the vaginal wall and puncture each follicle and aspirate each of those follicles to see if we can get mature eggs from those. And at the end of that process, we'll be able to tell you when you wake up how many eggs we've collected and whether or not all of those eggs are mature. And then the next step, of course, is to get usually a fresh specimen of sperm from the partner.
Well, I suppose, at that point, there's really a couple of different directions you can go with the eggs, right? Of course, women may be doing it themselves, so it could be a freezing process.
That's true. It depends on the actual reason
steps.
We're doing the stimulated cycle. So if it's for a woman who wishes to freeze her eggs for future fertility, the embryologist will look at those eggs, determine which, of course, mature eggs, they're the only eggs that we can freeze, and then cryopreserve those eggs.
And then if it's a same-sex couple,
then that would involve the use of donor sperm, so that it could be a known donor. If it is a known donor, we'd prefer a fresh sperm specimen on the day because fertilisation rates are much higher and the quality of the sperm is much better if it's a fresh specimen. And if we can't have the fresh specimen and it's donor sperm, perhaps anonymous donor sperm, then it usually comes in vials, which we call straws. And one of those straws is usually thawed the morning of the egg collection so that we can actually choose some live sperm. And often those sperm are, because sperm is a very precious resource, are injected into the egg in a process called ICSI. And that process can also be used if we're worried about the quality of the sperm or there are any other malfactor infertility reasons, then we often will use ICSI, but it's not for every couple.
And it must be a very similar process for the heterosexual couples as well.
Yes, exactly. So hopefully if the male partner is actually there on the day and not, as in Canberra, we often see couples undergoing the IVF process whose partners are in defence and they may be deployed, and we have to use some frozen sperm that they've kept for us before. But otherwise we do prefer to use a fresh sample of sperm, and that is placed in the dish with the eggs, and then we wait 24 hours to see if the eggs are successfully fertilised.
And so that all happens all at once?
So all of that process happens on the same day.
And what about a fresh transfer?
So a fresh transfer is the transfer of an embryo usually on day 5. So we call day 0 the day of the egg pickup. And then the next day we know how many of the embryos have fertilised. And then they're grown up to what we call day 5, where the scientists are responsible for checking the quality of the embryo. So they actually grade the embryo, and there are various different grading systems that are used, but we're able then to tell which may be the best embryo to transfer. And usually that is what they would recommend. Some embryos may be suitable for transfer, some may not. It's inevitable that after the fertilisation process happens on day 1, that usually not all embryos will continue to grow up to day 5. So from a batch of about 10 eggs, if all of them fertilise, we'd expect hopefully to have 3 good quality embryos at the end of that process. And then, of course, there's the decision of which embryo to transfer, and then if we're able to freeze the other embryos that remain.
Well, if I can just jump back a little bit, what's recovery like for after an egg pickup?
So usually it's quite good. So most ladies will need that day and the next day to recover. Most ladies have a little bit of pain relief in the post-operative period. We keep women for a few hours after the egg pickup because there are some risks associated with egg pickup that we can notice immediately, things like bleeding, and of course things like pain, which we can manage as the patient recovers. And usually by the next day, most women are feeling a little achy but completely fine and able to get on with a normal day's work. Or
so you're definitely taking a day off. You might take 2 days off.
I think so.
Okay.
And that's a very individual thing.
Sure. So we've got like you mentioned a 12 to 15 day stimulation period. We've got a pickup, which is a surgery, for lack of a better description. And then you mentioned that there's about 5 days of embryo growth.
That's right.
Where are we up to at that stage?
So the embryologists, usually from most laboratories, will keep in touch in terms of telling you what's happening with your embryos, how they're growing, what to expect, whether or not to expect a transfer on day 5. It may not be a couple's choice to have a transfer. They may be looking at freezing the embryos, all of the embryos, or even testing some of the embryos before they're actually transferred. So usually day 5, they'll have the embryo transferred, and every centre is different about when to do the pregnancy test, but usually it's between 8 and 10 days after the transfer that most people will go in and have some blood drawn and then do a pregnancy test on that. And then usually the nurses will call and let you know how things are going. There's usually the use of progesterone pessaries, which help to support the pregnancy early on, and those are usually started a few days before the embryo transfer.
And so what if a fresh transfer isn't an option?
So if a fresh transfer is not an option, then freezing the embryos is the best alternative, of course, because that enables perhaps a woman who might be hyperstimulated for her to recover and become a lot better, and for the hormones to settle down. And we know that frozen embryo transfers actually result in more pregnancies, more live births compared to fresh embryo transfers. And there's a few reasons why that might happen, but definitely these days freezing suitable embryos can give just as good pregnancy rates.
And so if you were to have to wait for after your surgery to have a new cycle,
yes.
Is that a matter of having another period?
So yes, usually we're waiting until those hormones have settled down, and we'd prefer to do a frozen embryo transfer in what we call a natural cycle, though that means waiting for your period to come and trying to time ovulation and transfer in as natural a possible way, so that we know a natural cycle frozen embryo transfer actually results in better pregnancy rates.
And then after an embryo transfer, you said that it takes about 10 days before you do that test. I'm sure a lot of people are using the pee on the stick.
Oh, yes.
Is that
so sometimes
what's the problem with that? Is that allowed? We can't stop someone.
No, you can't stop someone from doing that, but it depends on the type of trigger that's used as to whether or not you might get a falsely positive reading on your pregnancy home test. So if you do a urine test and the trigger that's been given is typically an HCG trigger, which is typically the same sort of molecule produced from pregnancy, unfortunately that may give you a falsely positive urine test. So we do advise waiting for the blood test, otherwise, you might be getting some false information. And it may be a little bit early when you're testing as well. So waiting to see what that pregnancy hormone level is like, and then usually we continue to follow that pregnancy hormone level until we've reached a reassuring level, and then we can actually do an ultrasound and check and see how the pregnancy is going.
Now, I know we've probably oversimplified a really complicated process in
yes.
5 or 10 or 15-minute conversation.
That's right.
There's lots of different things that can happen. Is that the easiest way to explain it?
I think so. I think every couple's journey can be very different, and I think that's why communication is so important through the cycle, so people understand why we're doing what we're doing, if we need to modify medications, if we perhaps sadly need to stop the cycle for whatever reason. I think the priority is obviously keeping the woman as healthy as possible and as safe as possible through that process, and trying to maximise her chances of having a successful pregnancy at the end of it.
And also, we may have just spoken about it in 15 minutes, but this is a month-long process, really. The stimulation, pickup,
and then the pregnancy
transfer
test. Yes.
Yeah, so there's a month there.
Yes.
In the best case scenario.
That's right. Yes, and sometimes, depending on the type of cycle that you're doing, some people will start by taking something like the pill and take that for a couple of weeks before they actually then stop the pill, have an artificial period, and we use that as their starting point, particularly if we have to time the pickup specifically. So typically from people who are travelling perhaps from the country and coming into the city for an egg pickup, or even from overseas, there are a lot of complicated ways that cycles can be run, and there are other atypical ways that we run cycles with different drugs, and that process can sometimes take many more weeks than just a month.
Thanks, Jodie. There's heaps of information for people out there, so I think that'll be super helpful.
Fantastic. Thank you.